prescribers are individuals who work individualistically, don't they? So there is a degree to which they follow guidelines, and there's a degree to which they have the freedom to practice their independent clinical discretion. And so it's a really interesting challenge when you're looking to get more conformity, if you like, or consistency in the way that you influence prescribing behaviour. This is one of the things I spent quite a bit of time studying, and there is research out there that says that it is quite difficult to change prescribing behaviour, and different studies have shown it can be quite impervious to change. And if you think about a GP, and they are maybe the vast range of different clinical areas they're dealing with, they're not going to read every bit of guidance that's out there and follow a guideline. I think that's not really realistic. So that's my point about, you might get something designed at the ICS level or at place, but the implementation and the leadership, and why I think you need to be talking to the whole team and not just the pharmacists, is going to be through that clinical leadership model. And that's the thing, when you said, you know, what's the most important thing in the report, I think that I come back to that, because if you don't have that local leadership from the medical leadership, you're not going to get the changes that you want to see. So you need people driving that and sort of educating at scale. And often we don't have huge amounts of resources to do that ourselves in the NHS, but I think we do need to do that. You know, the work I was doing around pain, and that was in part a prescribing program. We didn't call it one, interestingly, but we have delivered probably over 1,000 contacts of training around that across GPs, across pharmacists, across community staff, and more than once. And we've incentivized people to take part in reviewing their patients. And you have to keep doing it. It's sort of like, you know, to change a habit is really hard, isn't it? You have to keep chasing that behavior change, monitoring the data, providing the feedback. So it's not terribly easy to achieve that, that systemized response. So I think that's why you might, even if you design your guideline at a higher level, you need the leadership at the local level to drive adoption, and actually and spread of the change that you want to see.